Good morning, welcome back everyone. About 13 minutes before 7. According to a local cardiologist, chest pain and dizziness and fainting are common among adolescents. And these symptoms don't necessarily mean your teen has a heart problem. Gunderson Health System pediatric cardiologist Dr. Sue MacLellan joins us now to explain. Good morning, Dr. MacLellan. Thanks for getting up with us. I think when we hear of chest pains, we automatically think, oh my goodness, something is wrong with my child's heart. But that's actually rarely the case?
It is rarely the case, Amy. In fact, only about 1% of time is chest pain associated with some sort of heart problem.
And the other times?
What we know...
Oh, go ahead.
Oh, the other times it's associated with most often musculoskeletal pain, asthma, or sometimes even stomach issues. I think the big issue is that because cardiovascular disease is so well advertised in the country as a leading cause of death and certainly of disease, we decide to extrapolate or at least apply chest pain in children to being a heart-related issue when it isn't always the case.
But when do you know? I mean, you can treat musculoskeletal pain with Tylenol, and of course asthma and dehydration and reflux with over-the-counter and you know, stuff like that. But when do you know when it is something more serious, something that is related to the heart?
Well, I generally ask families to take an ask and touch approach, which means ask your child, is this pain happening often? Where is it occurring in your chest? What are you doing when it happens? And then I encourage parents to go ahead and feel the child's chest, to touch along the breastbone, to touch along the ribs. And if indeed the pain is occurring when you're touching and pressing on the chest, then you can be reassured that it's most likely to be musculoskeletal. There are some other symptoms to look for, though. If the child has fever or trouble breathing, if the pain is very severe and overwhelming, if they have racing heart symptoms or fainting, then those are times when you're going to want to bring your child in for evaluation.
And of course, you always want to lean to the side of caution when it comes to this.
Absolutely.
So maybe not call your pediatric cardiologist, but a call to the physician, a call to the nurse advisor, certainly well worth your time.
Absolutely. So the nurse advisors and the primary care physicians are well versed at dealing with chest pain in children. And in fact, most children are going to have chest pain at some time in their young life. And so it's so very common. But again, it's very unlikely to be related to the heart. And watch for those severe symptoms that I mentioned.
If you're having symptoms you're just not sure about and you take your child into their primary physician, what are they going to do? What will they do to screen out the bad heart stuff?
What's interesting is studies have shown that the majority of the time chest pain in children actually gets quite excessive evaluation. So our goal is to really take a history, look at clues in family history, look at the child's history, and from there decide what is going to be necessary testing, which might be a chest x-ray, it might be a breathing test, it might be an electrocardiogram looking at the rhythm. So there's a whole host of other things that can be done, but I think the stepwise approach is important.
All right, so don't panic. Take a breather,
Correct.
Take a step back, and of course seek medical attention if you think you need to. Dr. MacLellan, thanks so much for joining us.
Thank you.